Welcome to my presentation on importing overseas rescue dogs, an investigation into issues seen in UK veterinary practice. My name is Tobias Hunter and I'm a veterinary student at the University of Liverpool. Overseas rescue dogs imported into the UK have become increasingly common since the introduction of the EU Pet Travel Scheme in 2000, shortly after the first UK travelling dog died of babesiosis contracted in France. Aside from rabies, two additional disease risks include importation of cestoid parasite Echinococcus and ticks of a variety of species. The first outbreak of babesiosis showed 3 dogs from separate households contracted the disease without travelling abroad. The link was identified as an area of land where there had been a marked increase in the number of dogs rescued from abroad. This background led to this research project with 3 significant aims. Firstly, how many overseas rescue dogs are in the UK? Secondly, what type of health and behavioural issues do they have? And thirdly, how are vets tackling these issues when presented in practice? The research was conducted using SAVSNet, a surveillance database collecting from 10% of practices in the UK. Data included age, sex, breed, postcode, and free text notes from the consult. Searches were used for the name of all European countries, which brought back consultations of over 30,000. There was not enough time to read all of them, so a representative sample of 1,503 consults were read. The consults were categorised according to the reason for mentioning the country: emigration, immigration, outbound travel, inbound travel, uncertain or no travel. Data involving travel was then classified into the reason for the consult, travel, health check, vaccination and presenting complaint, further into the type of complaint and whether it related to travel, and then descriptive statistical analysis was performed. I will now show you the results. This slide shows the classification by travel type. You can see the number of consults and the type of travel at the top, and then this graph showing travel type by country. Immigration accounted for over a third of consults read, so 34%. The top 3 countries were Romania, Ireland and Hungary. Outbound travel was the next most common at 31%, with the top 3 countries being France, Spain and Ireland. Emigration and inbound travel accounted for 9% each, and false positives accounted for 14%, leaving 1,300 relevant consults. When analysed by species type, dogs were by far the most common at 76%. 38% of those were immigration consults, and the top 3 countries for immigration for dogs were the same as overall. Cats were the second most common species at 13%. 40% of those were immigration consults, and the top 3 countries for immigration for cats were Russia, Greece and Romania. Of the 1,300 consults that involved travel, 25% were classified as a consult involving a presenting complaint. Of those, 19% had some indication from the vet that the complaint was related to travel, and 94% involved entry into the UK from abroad, so either immigration or inbound travel. Consults were then categorised according to the type of complaint. A particular note of 3 diagnosed cases of leishmaniasis, 2 in cases of dogs immigrating from Portugal, and 1 case of a dog immigrating from Spain, so all 3 entering the country. These charts show a breakdown of the number of consults by presenting complaints. You have immigration cases here, inbound cases here. You can see the most common types were parasites, skin, respiratory issues, gastrointestinal, followed by the rest of the categories. Limitations to this research include the fact that the free text in consults was not enough to determine if the animal was rehomed from abroad or bought to move with the owner. It was not enough to analyse treatment plans as per the third aim. Therefore, further detailed surveys would be required. Limitations during the initial stage of text search show that country names may have double meanings and will be close to misspellings for commonly used veterinary terms. Examples include misspelling Spain as Spain, Hungary autocorrected to Hungary, Turkey in reference to the food rather than the country, and breed names involving a country, Netherlands dwarf rabbits, Russian blue cats, and so on. Some discussion points. The top 3 countries for dog immigration, Romania, Ireland and Hungary, were unsurprising, as Romania and Hungary are often targets for charities that rescue overseas dogs, and it's common for Dogs Trust to source a proportion of their rescues from Ireland. The top 3 countries for cat immigration, Russia, Greece and Romania, also correspond to the targets of overseas cat rescue charities, and there's also potential link to the import of pedigree cat breeds such as Russian Blue. It was noted on numerous occasions dogs were brought into the country with kennel cough, or cats were brought in with flu, and there were those 3 cases of dogs being brought in with leishmaniasis. This highlights the question: are current screening protocols adequate for disease prevention?